Banan, you're muted, please.
Good morning, good afternoon, and good evening to all who is attending the session today. Whether you are attending it live or whether you are listening to it afterwards through YouTube, welcome to this session. This is the 18th session for FIP Development Goal, Digital Program 2021, Setting Goals for the Decade Ahead. Today's session is going to focus in the FIP Development Goal 3, which is Quality Assurance. Let me introduce myself. My name is Banan Mukhallalati. I am an assistant professor in the College of Pharmacy at Qatar University. I finished my BSc in pharmacy in King Saud University, and after that I finished MBA in the Qatar University, and finally I finished my PhD in the University of Bath in UK. Currently I am teaching and doing research, and my research interest is health profession education. I've been working with FIP since a few years, and I've published with them several articles. And now I am one of the global leads for the quality assurance goal at which we are talking today. I will be moderating this session with Dr. Marwan Al-Aqil, who is an FIP project manager for workforce development goals. A few announcements, and before we start, these are like housekeeping announcements. This webinar is being recorded and is live streamed via YouTube. The recording will be available on our website in eventsfip.org. You may ask questions using the question box provided. There is a QA question box, and you are welcome to provide your feedback about the session to our email at webinars@fip.org, and you can become a member in the FIP by going into the website of FIP and opening the membership registration. Now I will hand over to my colleague, Dr. Marwan, to take over.
Thank you everyone, and thank you for the introduction. So we will be going over the elements of the Development Goal 3, the quality assurance, and thank you everyone for being here, for joining this webinar about DG3 quality assurance. So next, please. So it's a comprehensive online series of 21 events that will be delivered in 2021. We are in the 18th event. We still have 3 events coming in November and December. The outcome of the 21 digital events is to mobilize global pharmacy development and transformation through the development goals. By engaging our profession, members, and colleagues everywhere, we aim to provide a description, direction, and context for each specific goal. And at the end of the session, we'll be monitoring and evaluating through data, evidence, and identifying priorities across practice, science, workforce, and education. Our speakers will be tackling all these areas, and at the end, we'll be having an activity about monitoring the indicators of that goal. So, as I told you, we'll be having 21. We had 17 events. Today is the 18th, and we're still having 3 events. One on the antimicrobial stewardship by the end of November, where it will be coinciding with the antimicrobial week. And then we'll be having 2 in December, with the series finale being on impact. Next, please. So our events outcome are first to describe the FIP goals and explain the components of DG3, talking about different elements, workforce and education, science and practice, to showcase the FIP tools and resources in order to support the Development Goal 3 implementation across these elements, to identify priorities across practice, science, workforce, and education, and of course, to engage our members in an activity to support monitoring and evaluating of the goal through data evidence. So we're glad to have our esteemed speakers with us today. We have speakers from all over the country, from over the globe. So Aline, Bronwyn, Abby, Sandra, Mike, and Abir will be presenting their experience in the quality assurance in different areas. We will be going over introducing them whenever the speakers will be presenting their slides. Thank you for being with us. And to note, I will be having like a small intervention during this webinar in order to talk about the quality of publications. Next, please. So the one FIP goals, we can have no pharmaceutical care without the pharmaceutical workforce, and we can have no pharmaceutical care without a scientific foundation for the next decade. And that's why we see that practice, science, workforce, and education should be all together in order to assure that we are delivering good pharmaceutical care. So the development goals are 21 development goals, and we will be going in the next slide through a video that will present and introduce those development goals. Next slide, please. So today's goal is quality assurance, and we will be going over the next few slides about the different elements of quality assurance. Next, please. So as we said, we have the workforce and education element, the practice element, and the science element. And the next slide, we'll start by the workforce and education element. And this element will, as a description, is a transparent, contemporary, and innovative processes for quality assurance of needs-based education and training systems. Our mechanism for the workforce and education are to ensure the quality of the workforce by quality assuring the continuous development and the delivery of adequate and appropriate education and training. Also, we will be tackling the quality assurance need for the academic and institutional infrastructure, establish standards-based global guidance for quality assurance of pharmacy and pharmaceutical science education, implement fair, effective, and transparent policies and procedures for quality assurance, and define critical stakeholders' input on development of adequate education and training. Next slide, please. So for the workforce and education element, we have our leads that are all present here today in our webinar, Abir, Bronwyn, Abby, and Banan, that are now taking care of the DG3. We do have also a workforce reference guide. Please visit this workforce reference guide at www.fip.org, WRG DG3, and you will see all the activities of DG3. Next slide, please. If we go now to the practice element, It's also a transparent and contemporary innovative process for the quality, assessment, monitoring, and improvement of services in practice. The mechanism will be to define standards for practice by pharmacists and support workforce in community, hospital, and other direct patient care roles, develop standard-based guidance, practice support tools, and self-assessment tools for the implementation and delivery of professional services, ensure systems are in place for upholding ethical practice, establish mechanisms and indicators for quality improvement, ensure the quality and effectiveness of pharmaceutical services, and establish mechanisms for real-world, pragmatic, and useful evidence-based services implementations, evaluation, and monitoring in order to audit systems and, of course, patient feedback, health outcomes, research, and cost-effectiveness measures. Our third element is the science element, which is the quality and integrity in pharmaceutical research, development, manufacturing, and regulations to assure access to safe and effective medical products globally. The mechanisms are to create an accessible library of guidance document defining quality assurance criteria for pharmaceutical sciences, develop tools to improve knowledge of national regulatory requirements for medical products, and to collaborate with global and regional stakeholders to develop mechanisms aimed at reducing substandard and falsified medical products. And here it's worth noting that we have the regulators forums at the FIP, and the regulators forums works mostly also on quality assurance. So stay tuned for all the activities that the regulator forum will be delivering in order to know more about their work and how do they tackle quality assurance in their work. Next slide, please. I will hand over now to Banan in order to start introducing our speakers.
Okay, thank you, Marwan. I will start with the first speaker of today. We are delighted to have Dr. Mike Ross with us. Dr. Mike is the Director of International Service Accreditation for Pharmacy Education, ASPE. He has established the International Forum for Quality Assurance of Pharmacy Education, and he authored the FIP Global Framework for Quality Assurance of Pharmacy Education in 2008 and again in 2014. He was lead for quality assurance for FIP's education initiatives and served as a co-lead for continuing education and continuing professional development. And he was active in FIP, serving on the board of directors, Bureau, board pharmaceutical practice, Foundation for Education and Research, and community and academic sections, executive committee. Thank you, Mike, for joining us today, and the floor is yours.
Thank you so much, Banan, and thank you very much to FIP for inviting me to present some introductory comments at the start of this very, very important webinar. I would like to say that my comments are going to focus primarily on the area of education, pharmacy education today, recognizing, of course, that quality applies to the three areas as has been explained by Marwan, but my comments are going to focus primarily on the education aspect of quality assurance. And I've entitled my presentation today, Committed to Quality, Committed to Change. Because if we're thinking about transformation, it's not just about incremental change. We need to ensure that we are changing our pharmacy education and the quality thereof in a very strong and very strategic way. So it's a commitment to quality, of course, is vitally important, but also that commitment to change. And in fact, even beyond just change, it's transformational change. Not small incremental changes is our target, but transformational change. Change without quality can lead to chaos. So it's very important that if we're going to have transformational change, it needs to be based on the principles and assure the quality of our change. But importantly also, if we don't have change, but we have quality, that can lead to stagnation. So we need a combination of that commitment to change and that commitment to quality at the same time. Many of you will be familiar with FIP's Global Framework for Quality Assurance of Pharmacy Education, which I was privileged to be involved starting about 20 years ago now in the development of this work. If you're not familiar with this document, I would strongly encourage you to have a look at the website and download that document. The goal of quality assurance is really just beyond that core area of just quality assurance. It should go well beyond that to, sorry, we seem to be advancing our slides a little bit too fast here. I'm not sure what's happening. Let's try go back and catch up. We want to be not only assuring the quality of our pharmacy education, we need to be advancing the quality at the same time. So that's the commitment to quality and the commitment to change. How do we achieve this? Sorry, let's try and get back to the slides. I'm not sure why they're advancing automatically here. Maybe Banan, you can just, let's let you take over because I'm not sure what's going on with the advancing of the slides here. So the first area we need to ensure is that we have that commitment, as I say, not only to assurance, but a second part of our mission should be the advancement of quality. And the FIP framework for quality assurance of pharmacy education has captured several key principles, and these are what I would like to just introduce you today if you're not familiar with. Can we go back to the, first of all, the slide on needs-based education? There we go. So this is one of the key diagrams and key graphics in the FIP quality framework. It talks about the needs-based education model developed by FIP, and it really is the driver or the key point in terms of how we're going to design and deliver pharmacy education at our faculties of pharmacy, colleges of pharmacy, and even our continuing education. The same principle applies. We need to be considering the end in mind. And what is the end in mind? Our end in mind is solving our national, local, regional needs and priorities. In order to solve those needs, our members of the pharmacy workforce have to be providing services to meet those needs. And in order to provide those services, all the members of the pharmacy workforce have to have the desired competency, the needed competencies, and our education, whether it's at our faculties of pharmacy or our continuing education activities, need to be ensuring that the outcome is the competence of our graduates, the competence of our pharmacists to deliver the services and meet those needs. And so this is a very different approach to how we've perhaps traditionally designed and delivered our education, particularly at our faculties of pharmacy. It's called the needs-based or the competency-based model for pharmacy education. On our next slide is another graphic that comes out of, another two graphics that come out of the FIP framework, and it talks about how we can strategically approach transformational change. And one of the key elements here is the involvement of all of our stakeholders. So first of all, we have to identify who our stakeholders are, who are going to be important to the quality of our education, and work actively and collaboratively with them. The three key sectors in any profession are practice, education, and regulation, and there needs to be strong and clear communication and cooperation between those sectors. But beyond that, there's a much wider range of stakeholders, as we see on the right-hand side of the slide, a much wider range of stakeholders that we need to be identifying and actively involving in our process, so that as educators, we're not remote from the rest of the world, the rest of society, the rest of the profession. We have to be engaged. On our next slide, we have also some key elements where we describe how the quality of education can be assured. This is the pillars and foundation model outlined in the FIP framework. So we have here 5 pillars which support quality and the achievement of quality, and 3 foundations. We'll see here that the 5 pillars are context, structure, process, outcomes, and impact. And then below that, we have 3 foundations. On the next graphic, we'll see the 3 foundations of science, practice, ethics, science being the base for knowledge, practice being the base for experience, and ethics being the base for attitudes and values that are so vital for our pharmacists in order to deliver those patient care services. And this is the competency foundation. The FIP framework has a 5-pillar model, But I had the opportunity several years ago to visit Armenia, and our host took us to this very nice temple just outside the capital city. And we were looking at it and we said, oh, that just looks like the model that's in the FIP framework, but it had 6 pillars. So as we were thinking, we said, if we had a model in the FIP framework with 6 pillars, what would the 6th pillar be? And we all came to the same conclusion at the same time, and we've labeled now that pillar with what we feel is the most important next step, and that is innovation. So if we can just advance the slide, we'll see what the next pillar is, the pillar of innovation. And so here we'll see that our quality development or our transformational change is not a static or a linear process. It's more of a cyclical process, whereby if we're having the desired outcomes and impact of our education, we're changing the context. So we have this continuous cycle of quality improvement, which really should be the ultimate goal of pharmacy education, is this continuous quality improvement. So here we're seeing the commitment to quality by adhering to all those pillars and foundations of education, but then moving beyond that to having impact and changing the context and having that transformational change, which we're trying to achieve. And with that, thank you very much for your attention. I hope it's laid a nice foundation for the rest of the speakers to build on. Thank you very much.
Thank you, Mike, for this comprehensive and rich presentation. I will hand over now to my colleague as a global lead for the Quality Assurance Goal, Abby Kahle. Abby has devoted her academic career to pharmacy and public health education. She is tenured and board of trustee faculty in Roosevelt University College of Science and Pharmacy and Health. Abby earned her PhD in pharmacy from the Department of Social and Administrative Sciences from the College of Pharmacy, and her master in health management and policy from the School of Public Health at the University of Michigan, Ann Arbor. Abby completed the following certification programs at American Pharmacists Association: Advanced Motivational Interviewing, OTC Advisor, Advancing Patient Self-Care, Pharmaceutical Care for Patients with Diabetes, Lipid Management Program, Pharmacist Provided Immunization Program, and the Delivering Medication Therapy Management in the Community. Thank you very much, Abby, and the floor is yours now.
Thank you so much, Banan, for this kind introduction. I also want to thank my colleague, Mike, for starting our presentation today. Mike and I, we had actually the privilege to conduct a certification global visit. And I think the common theme we're going to see today is how to use quality assurance tools to continuously ensure the quality of the education. So without educating the workforce, we will not be able to continue to have our practice and science, as well as our future pharmacists, be the best possible education, but also training and initiative in public health. So what I wanted to share with you is how we started. The first self-assessment tool my colleague and I, we established with the support from FIP. So you may recall 2017 FIP published the actual Nanjing educational outcomes. So my colleague and I, we decided, why can't we actually build a bridge, if you will, between the ACPE, which is what Mike referred to earlier in the presentation, and the FIP, those quality education outcomes. There were about 67 of them, and they were approved by about 37 countries. So we decided to map them to each other, if you will. And in the next slide, we'll be able to see how we were able to map actually both the ACPE standards and the Nanjing statement. Almost half of those within ACPE were actually mapped. And we did also a reverse mapping. So we took the global educational outcome and we mapped into ACPE. And there were some common themes that we found. And we also found that there are some gaps, if you will. So we decided to develop our self-assessment tool. And in the next slide, we can see that they are actually, these particular tools helped us build the next step. So what we wanted to do, as the global lead mentioned for DG3, is to review what was the quality assurance survey that was developed by FIP last time. And some of you already read the publication from the Center for Excellence in Africa report that my colleague and I on the DG3 actually published. We took this survey and we looked into this data, and we decided there are also some gaps that we may want to put together as recommendation moving forward. So we took this outcome report and we built our current instrument that we have here. So on the next slide, we'll be able to see that we put together elements of the survey that my colleague is going to share with you next. We wanted to target area that could be comprehensive. So we're talking about definitely the accreditation or certification process. We want to ask who are these responsible parties for the quality assurance. And we also wanted to make sure we are following the ethical consideration for the survey. So we developed a consent form that we're going to send out when we are ready to finalize the IRB approval to test it. We also reach out to our hubs. So we reach out to them with the draft instrument to enhance the face validity of the study. And we receive some feedback from them and comments and suggestion on modifying the instrument. So all these actual suggestions were implemented. And what you're going to see next with one of my colleagues' presentation is the actual items. I wanted to also encourage you to refer back to the publication that we have with the FIP. Some of you may know I am an associate editor for the FIP Pharmacy Education Journal. We're going to talk a little bit more about that. But I really want to encourage you to refer back to all these tools that have been published and also keep track of what's the recent trend in pharmacy education workforce. I think we owe it to our patients and public health to not only enhance the facilities, but also continuously enhance the education for our workforce. Next slide. I'm going to pass the baton to my colleague who's going to tell you specifically about the survey instrument, and I'll look forward to talking with you a little bit later in the program during the panel discussion. Delighted to have you, everyone.
Thank you, Abby, for your introduction about the effort that we have done together in order to build the survey tool. Thank you very much. Now I'm going to introduce my colleague, Abir Al-Ghanim, to talk about more comprehensively about the QA tool. Abir is an academic leadership fellow of the American Association Colleges of Pharmacy. She has past chair and commissioner of accommodation at Accreditation Council for Pharmacy Education International Services Program. She is in the board of trustee member at Talal Abu Ghazaleh University College for Innovation in Jordan, and a global lead for DG3 Quality Assurance at FIP Workforce Development Hub. Abir received her BSc in Pharmacy from University of Jordan and the PhD from the University of Kentucky College of Pharmacy, and she has been involved in several international education and practice services, such as the United States Agency for International Development in Jordan as a steering committee member for Interprofessional Education in Health Sciences. Thank you, Abir, for joining us today, and the floor is yours.
Thank you, Banan, and good morning, good afternoon, everybody. It's a pleasure to be with you today. I'll be talking more about the FIP quality assurance tool that our team managed to work on. In fact, like you know, it was a pleasure, informative, enriched experience to learn more about what has been done before through the FIP and try to build on the tool to come up with something more comprehensive, something that we could use, hopefully, to be able to get more information and help lead with the quality assurance education at a global level. So what we did at the beginning, basically, we looked for what the FIP initiatives has been done before, and there was the report about the work that has been done at the Sub-Sahara survey between the FIP UNESCO, the UNITWIN Center for Excellence in Africa, and that work has been really instrumental for to build our tool on. We managed to make a very nice publication out of it and learn a lot about the different angles of questions that we could ask in order to help us assess the quality within those countries at a global level. So what we did next, basically, we came up with a tool, and our tool has 3 major sections, basically focusing at the first on the accreditation process and accreditation bodies within the countries. As we learn more about this, we move to the second section, which is standards for quality assurance, to help us assess the standards they use. And then at the end, views on the value, relevance, and outcomes of accreditation in the country. So what we did, basically, as we built on the UNESCO UNITWIN Sub-Sahara survey, we put those sections together. And basically, I just want to go with you, like, in summary, and you can learn more about it as it will be released, and you can have more information about it. But mainly with the first section, when we talk about accreditation process and accreditation bodies, we're looking for, to understand more. Does the university, faculty, school, academic programs undergo periodic accreditation by an external accreditation body? Those questions will help us understand more the levels of quality assurance at that institute. And then look for which of the following is accredited. Is it the education institutes, the universities, the colleges of pharmacy? Is it the academic program? At which level or layer the quality and accreditation would go in within? Then understand more about who's the accrediting body at your university, and then at the school, then at the pharmacy program, and then understand what type of accreditation activities undertaken. How often is the program subjected to accreditation, and how often the university is subjected to accreditation? These questions would help us assess and understand more about the layers or level of accreditation. Now, working with Mike, as you know, the executive director for the ACP International Service Program, there are a lot of programs that you would learn about at a global level. Sometimes, we are centered within our own country or our own standards, but the more you learn about others, the more you understand, and this brings me back, to understand more about their standards and how can we share knowledge to be able to assure levels of equality. So with the section number 2, as we progress with the tool, basically it will talk about accreditation standards within the country. So are there regional, state, provenance, national accreditation bodies within that place or within the country? If yes, then they proceed to tell us, who would be doing or sets those accreditation standards for the pharmacy program. If no, then we need to understand what standards or framework that are currently used for quality assurance of pharmacy education. Now, also, we would like to learn more about the components, the requirements that are included in the accreditation standards. So we give them options, and they can tick all that apply. For example, prescribed hours of study, prescribed numbers and levels of academic staff, performance outcome, interprofessional education requirements, all those. And if there are more, they could easily list them. And then with the third section of our quality assurance tool, we're more focusing on value, relevance, and outcome of accreditation. In other words, we give them a scale from 1 to 5 to be able to answer the questions, for example, to give you their opinion about the current accreditation in their own country. For example, upon that scale from 1 to 5, they could tell us the accreditation system for pharmacy education in their own country is relevant. is the accreditation system of pharmacy education in their own country add a value to the system? The standards used for accreditation of pharmacy program in their own countries are appropriate for the contest. So in this really, like, section 3, we are trying to learn more about self-assessment from the people who would be able to answer the quality assurance tool to let us know about their own evaluation of their own accreditation system and the outcomes coming of it. For example, like, the quality assurance of education in the country assists the maintenance and advancement of standards in the pharmacy practice, understand more, like, about their own evaluation of the system. And also we ask to describe the pharmacy or the university accreditation panel, and feel free to add any additional comments. The more, please, and this is a welcome for all of you, the more info people add, the more you enrich our knowledge, and hopefully we'll be able to get more open opinions about the quality assurance at a global level. So with this tool, basically, we are thinking of this is something that can be used as self-assessment for those who would answer the survey, but also it's intended to support pharmacy schools in their own assessments of advancing their quality and their pharmacy programs. And hopefully the data that we're going to collect will help us better understand the quality assurance of pharmacy education and programs and come up with recommendation. And in fact, that makes me, I saw in the quality, in the QA box, question from Pascal asking, like, how can the FIP help with quality assurance in the pharmacy education in developing countries? And, definitely this is a step, a further step to build on what Mike Rouse and the FIP team on the UNESCO Unit 1 did, basically, whether with the surveys or with the reports they had before, trying to have a comprehensive collection of information with this QA tool, and then come up with a recommendation that we can help through the FIP pass to developing countries all over the globe, and be able to communicate in order to share some of the standards and quality assurance measures that could help further. Thank you so much, and it's a pleasure to be with you. I'm looking forward to the panel and discussion.
Thank you very much, Abir, for going into the details of the QA tool. I'm sure that you and all of us can't wait to start administering this tool to different countries and get the results. Thank you very much. Now I would like to introduce my colleague, Brennan Clark, to this session. Also, Brennan is one of our colleagues as a global lead for quality assurance. Brennan is the Chief Executive Officer of the Australian Pharmacy Council, the standard setting accreditation body for the pharmacy education and training. Prior to that, she was the Chief Executive and Registrar of the Pharmacy Council of New Zealand. Brennan is immediate past the chair of the Health Professions Accreditation Collaboration Forum, the body for 16 regulated health professions in Australia. She represents pharmacy in several national bodies in education and health, and leads work in the development of interprofessional education and collaborative practice. Brennan is a global lead FIP, quality assurance, as I mentioned, is a member of International Committee for the Lifelong Learning in Pharmacy International Conference, which is very well known to all of you. Thank you, Brennan, for being with us today, and the floor is yours.
Thank you very much, Brennan, and it's great to be here. It's evening for me here in Australia, so welcome to everyone. Good morning, good afternoon, good evening. It's fantastic to be able to be part of this, and I'd like to thank FIP for the opportunity. If I could have the next slide, please, Brennan. We here are talking about quality, and I'd like to start by, first of all, acknowledging that I live here in Australia on the traditional owners' land, the Ngunnawal people, which are here in Australia, who are the original Aboriginal people in the land that I live, and I want to pay my respects to their elders, past, present, and emerging. I'd also like to just share this photo. If we can go back, please, Banan, the photo of the previous slide of the footsteps that are in this picture. These footsteps are from a piece of artwork that we have in Australia that our Australian Pharmacy Council has had commissioned. And they are talking about our journey of reconciliation, but they're also talking about our journey of being together. And I think tonight I want to talk about interprofessional education quality assurance. And so I've called my talk about with and from each other, and that's assuring quality in education across the health professions. I know this is an FIP event and we're all pharmacists, but pharmacy is part of a team and we can't work alone and we shouldn't work alone. And so while we're talking about education standards and quality assurance, one of the key things for us is that we need to think about how that works with all of the members of the team. So first of all, we have to think, well, what is interprofessional collaborative practice and why do we need it? I put up on the slide the definition of interprofessional collaborative practice that was agreed through the WHO. And collaborative practice occurs in healthcare when multiple health workers from different professional backgrounds provide comprehensive services by working with patients, their families, carers, and communities to deliver high quality care across settings. Interprofessional education is often the basis of interprofessional collaborative practice. And if we want our practitioners and our pharmacists to work as collaborative practitioners, we need to give them those tools early. So one of the things that we do as part of our training for our profession is to train them to be interprofessional collaborative practice through IPE or interprofessional education. And the key thing, I think this WHO definition really sums it up. Interprofessional education is when two or more professions learn about, they learn from, and they learn with each other to enable effective collaboration and improve health outcomes. There are many ways that interprofessional education can be delivered by our education providers, by our universities and training institutions. And I'm not going to talk about the ways, but I am going to talk about how do we ensure that there is good quality in the interprofessional education that we give so that we can have good team players in our pharmacists. So in the next slide, I'm describing about how important it is to ensure and advance the quality of our interprofessional education within our pharmacy programs. IPE or interprofessional education is a base platform for that interprofessional collaborative practice. And having standards that set what should be taught and maybe how they should be taught is a really, really strong lever to develop up our team player pharmacists. For many of us, standards would be set by the accreditation body for that profession. But for some, standards may be set by a higher education institution or by government or by a ministry, and they are for across professions. But what's key is that we need standards that all professions agree on. We can't learn about, with and from if we don't collaborate on how we actually develop those. So we need to think about what are the standards that we in pharmacy need and what are the standards that those of the other health professions in medicine, in nursing, in midwifery, in physiotherapy, in all of the other health professions that we have. In the next slide, I'm just describing here how in Australia, the method we have of setting quality in education is set by professional bodies for each of the health professions. And we have 15 of those bodies in what we call the regulated health professions in Australia. And they include doctors and nurses, pharmacists, dentists, psychologists, chiropractors, and all the people listed on this slide. All of these professions have an accreditation body, which all works under a national law we have in Australia. And each of these professions has the bodies are vary in size and complexity. For us in pharmacy, the APC, or the Australian Pharmacy Council, is 40 years old. So it's quite an established organisation and quite an established process for pharmacy. And we set the standards for pharmacy education, and we accredit providers against those, as well as accrediting pharmacists and interns. But we can't do this alone. So in the next slide, we have a body called the Health Professions Accreditation Collaborative Forum. And some of you may have similar bodies in your own countries. So while we have a pharmacy body and a medicine body and a nursing body, we all actually work together really well through a big collaboration. And in our collaborative forum, while we do our own specific work for our own professions, we collaborate on frameworks and standards and guidelines across all the professions. And we partner on a project that works across the professions. And interprofessional education quality is obviously a really important one for us. In the next slide, I'm going to describe how we looked at what we were doing about our IPE, or our interprofessional education standards. And we conducted a survey across these 15 health professions in 2019. If we were all saying every one of our practitioners needs to be able to work as part of a team, then we should be asking consistent things across pharmacy, medicine, nursing, and the others. So we did this survey to gather that information so that we could develop what we thought were good guidance for what IPE should look like and how we could support all of the professions in doing this. In the next slide, I've got some high-level outcomes from our survey, where we found that all of our 15 professions actually had a standard that required interprofessional education to be clearly articulated and taught in a range of ways, and that they all had criteria that focuses around elements of the curriculum that ensured that students learnt with, from, and about each other. We also found that our assessments across the 15 professions were generally well established, and there were different approaches, but they were of a reasonable standard. What we also found, though, are the things here in blue, that we didn't have good consistency across the way we were all assessing interprofessional education, which seems somewhat silly when we think that we're all trying to produce people that can work together. So we should be doing things that are more similar. That the panels and the people that go and visit our universities and education providers didn't necessarily have training in interprofessional education. And we also found that not all of our members involved people from other professions in those accreditation visits. So in our next slide, we've identified a number of steps that we will do to develop guidance on interprofessional education standards for all of our professions to use. We're developing up training for our accreditation panels. So that will be from nursing and medicine and dentistry and occupational therapy and pharmacy, where they will all have a base of what they're looking for in education programs. We're sharing our panel members, so we will have some medical people on the pharmacy panels and vice versa. And we're also workshopping up some best practice ideas for the sector. So that's a very quick description of the work that we've done around interprofessional quality assurance. And I'm going to, the last slide's just to say thank you for listening. If you want any more information about that, and happy to have a chat later when the panel is there. Thank you very much, Benan.
Thank you very much, Brenine, for this presentation and for presenting your interesting work about quality assurance of interprofessional education. This is really interesting. I would like to introduce our fourth speaker for today, Aline Haj. Aline Haj is an associate professor and researcher at St. Joseph University in Beirut. She completed her PhD in pharmacology and got her degree from Paris Descartes and USJ. Laureate of Paris Descartes in 2019, and finalist of the Franco-Lebanese Excellence Award in 2015. She was an invited professor at University of Minho in Braga, Portugal in 2018. Aline is currently conducting her research project at the LPCQM laboratory, working mainly on pharmacogenomics and clinical pharmacy projects to provide the best pharmaceutical care to patients in the context of personalized medicine. Aline is a member of the research committee at the Women Heart Health Center, Yaduna Foundation in Lebanon. Thank you, Aline, for joining us today, and the floor is yours.
Thank you so much, Banan, and thank you everyone for the invitation. Thank you, FIP, for inviting me to be part of this session. Banan, I will leave you the remote control, not to have issues with that happened with Mike before. So if you can move, please, to the next slide. So allow me today to discuss more quality assurance in a completely different area than what was previously discussed during this webinar today. And I'm going more to discuss what we call quality assurance in sciences and lab, with the focus to pharmacogenomic testing, as long as I'm working in a pharmacogenomic setting. So when we discuss quality assurance about labs, whether in a research setting or diagnosis setting, it includes a range of activities that enables laboratories to achieve and maintain high levels of accuracy and proficiency, despite any change that might happen to the test methods or to the volumes of specimen that has been tested. So each lab should have a good quality assurance system that allow us to establish standard operation procedures, SOPs, for each step at the laboratory testing process, ranging from specimen handling to instrument performance validation. It would allow us to define what are the requirements and mandatory record keeping, data evaluation, internal audits, to be able to monitor that we are following and we are adhering to the SOPs previously mentioned. Of course, we have to specify what are the corrective actions, how we should document them, and who are the persons that are responsible of carrying out any corrective actions if any problem occurs. And finally, of course, this quality assurance system should allow us to sustain high quality employee performance. So when we discuss quality assurance among pharmacogenomic testing, pharmacogenomic is a new concept that has been recently implemented in clinical care that allow us to have DNA from the patient after his consent, of course, and to be able to genotype them, to be able to understand how the genetic variation are able to tailor management therapies, and how we can have what we call the concept of personalized medicine or genotype-guided prescribing. So in order to be able to do so and to be able to have reliable testing, next please, we need to have accurate and reliable pharmacogenomic testings. And it is important to have as well a good quality assurance system within our labs. A very interesting article has been published in Nature a few years ago, where they discuss the quality control and the quality time among labs and in science. And what was interesting about this article is that the author described a representation or graphical representation of several errors that could happen in a lab, and highlighted how the quality assurance manager and system would spot these errors and allow them to improve in order not to have any issues later on with the results. So if we look closer, next please, if we look closer to the picture and we try to highlight and spot what are the errors, next, please. So we can see at the first error that can be seen in a lab is what is related to sample storage. We have to have a very organized sample storage. As you can see in this picture, we have disorganized sample storage. So we have to have clear labeling, proper organization for incubators, pre-freezer, and so on, so that everyone in the lab could be able to identify any sample that is present in the lab. The second important point is that we need to monitor and to register anything that is related to what happens in the lab, whether experiments, whether everything that is related to our lab work. And we need to have an adequate data logging. The data log should be in a notebook. Eventually, it could be digitalized. However, it should not be mentioned on a loose piece of paper or on a memo paper. Another point that should be addressed whenever we discuss pharmacogenetic testing is, if you can see in this picture in here, you have two members of the lab, both working on the same experiment, but each one of them is working in different conditions. The first one above is working on ice. The second one is working without ice. So that should not ever be done in a lab. We have to have protocols for each experiment, and protocols are here to be followed to the letter in order to avoid any deviation. And if any deviation happens, we should document them. As you know, in pharmacogenomic testing, the single change in temperature or the single change in reagent concentration could lead to different results and different interpretations. So this should not be done. And of course, we have to know how to work on, for example, under a hood or PCR station to avoid any contamination with other DNA. We move on for the second error that could be also be performed in a lab, in science or in a lab or in pharmacogenomic testing lab as well, is what is related to data analysis. We should never have unsecured data analysis. All lab members should have their own access, their own password to access data. And in case you have a data that everyone is working on the lab, we can lock it in order to avoid any data manipulation, particularly if we're talking about unintentional manipulation. Of course, when we discuss lab, we have to discuss reagents, and all reagents can affect experimental results. So we have to specify all reagents for age and storage conditions to be able to respect and to have what is required for the experimental results. And of course, finally, we should not forget at all that we need to have a performance, and all instruments should be calibrated and maintained according to a regular documented schedule that should be respected. Of course, we know that in a lab, the lab is here to perform analysis, and please next, not to be eating. So we have to avoid as much as possible eating in the lab setting. Of course, we have also, please next, we have to manage as well waste, especially when it comes to managing waste related to anything biological samples, such as blood or so on. And finally, of course, pets are friendly, but not at all in a lab setting. So these are some of the errors that could happen, and that quality assurance system would avoid having them in a lab. And I will just finalize my presentation by discussing an important point to tell you how important it is to have that quality assurance system within a lab, whether in a research setting or a clinical setting. If you look at the STROPES guideline, that are a guideline that has been implemented last year for strengthening the pharmacogenomic studies. And if you can see in here what I described in number 21, that is related to material and methods, they describe that we should identify all lab methods, including sources and storage of DNA, how are the genotyping methods, what are the platforms, and everything that is related to lab. So if you have a good assurance system, quality assurance system within our labs, we would be able to reproduce all these information and have a good pharmacogenomic studies. And of course, I would like to say that we need to have, within that quality assurance, we need to have quality control materials, such as negative and positive control for all testing, because they are necessary for producing accurate and reliable testing results. So that's it. Thank you for your for listening, and this is everything that I wanted to say related to quality assurance in science and in labs. Thank you.
Thank you very much, Aline, for your nice presentation, which was really very practical and interesting through this photo that practically introduced us to mistakes that can happen in the lab. Our next presenter is Sandra Winkelbor. Sandra is a pharmacist with a Master in Public Administration and is the manager of registrant competence at the Ontario College of Pharmacists. Sandra is responsible for providing leadership with the development, implementation, and ongoing maintenance of the college registration, quality assurance, and professional development programs. Sandra is also a board member and past president of the Canadian Council of Continuing Education in Pharmacy, the National Pharmacy Continuing Education accreditation body. Prior to joining the college, Sandra was the Director of Education at the Ontario Pharmacists Association, where she created the first certification professional development programs for pharmacists in Canada. Thank you, Sandra, for joining us today, and the floor is yours.
Thank you, Banan. And if I'd like you to keep moving the slides for me. Thank you. I'll let you know when. So good morning, everyone, or afternoon or evening, depending on where you are. I'm in Canada, and it is early morning here. So as Banan mentioned, I work at the Ontario College of Pharmacists, which is the regulatory body for pharmacists, pharmacy technicians, and pharmacies in Ontario, Canada. And I'm going to be talking about quality assurance in a different way. So we've heard about quality assurance in education, we've heard about quality assurance in science, and my focus is going to be on the practice element. So quality assurance for pharmacists and pharmacy technicians that are working. So in the next 5 minutes, I'll talk about OCP's mandate, the legislation, our model, and our right touch and risk-based approach. Next slide. So similar to other regulatory bodies, the mandate of OCP is to serve and protect the public interest. One way to achieve this is to ensure the quality of practice of our professionals through a quality assurance program. The goals for quality assurance are twofold, and these are reflected in the objects of the college. First, to identify those that are not meeting standards and to help them remediate. This is usually a small percentage of people. And going back to what Mike was talking about, this is the quality assurance aspect. Secondly, to assist in improving practice for those that are meeting standards. So this is for the majority of practitioners, and this is the quality improvement aspect. So it's both about quality assurance and quality improvement. Next slide. So in Ontario, all regulated health professions are required to have a quality assurance program, and we have 26 regulated health professions in Ontario. So the quality assurance program includes continuing education or professional development, self, peer, and practice assessments, and a mechanism to monitor registrants' participation. Next slide. There are a number of quality assurance activities that regulators can require, and many of you will know all over the world there are different types of quality assurance programs in place. So I'd like to share how the Ontario College of Pharmacists determined which QA activities to include in its QA program. So we started with the research. Some of you will be familiar with the multi-jurisdictional, multi-professional review of QA assessment mechanisms that Zubin Austin and his colleagues published in 2017. The key findings include current evidence has not identified a best QA activity. When implemented in isolation, most QA activities are unable to capture competency in its entirety. And finally, current best practice promotes taking a multimodal approach. Next slide, please. So based on these findings, the model shown here has been chosen. Although we have the same model for pharmacists and for technicians, I will focus on pharmacists to describe the various components. So as you can see, the pharmacist engages in multiple QA activities, and these occur at different times. So each of these QA activities provides feedback that either validates their current practice or identifies learning opportunities. In this way, each of these activities feed into determining what ongoing professional development is needed. I'd like to take a moment to touch on, can you go back to the previous slide? I'd like to take a moment to touch on right touch regulation. So right touch regulation is about focusing on the right things. And for quality assurance, the right things to focus on are those things that will make a difference in patient care. So for OCP's QA program, the knowledge assessment focuses on ensuring that pharmacists have up-to-date knowledge and skills. And the practice assessment focuses on ensuring that pharmacists are engaging in the right activities, engaging in the right patient care activities in their practice. So by that, I mean things like engaging in patient assessment, engaging in decision-making, communication, and documentation. So the ultimate outcome, which you can see at the bottom of this diagram, is improved practice and improved patient care. So this is, it is about identifying what learning needs are. We also have a self-assessment, but many of you will know that that people are generally not great at self-assessing the gaps that they have. So our other quality assurance assessments help practitioners identify where they need to do learning. And then there's the whole other part of making sure that we have that education available for them. Next slide. So this diagram illustrates the various QA activities that we have address differing competencies. So they work together to achieve the outcome of improved patient care. And this is why using a multimodal approach is current best practice. In addition to the assessments that are part of the QA program, so those are the three on the right-hand side, the practice assessment, the knowledge assessment, and the self-assessment, OCP engages in other QA activities that focus on the pharmacy rather than the registrant. And those include pharmacy assessments, which are also shown on this slide. And we also have a medication safety program. So all of these things work together with respect to quality assurance of practice. Next slide. So this diagram illustrates the risk-based approach for the practice assessment, and a similar approach is used for the knowledge assessment as well. So if you take a look at the top of the diagram, step 1, all practicing pharmacists engage in step 1, and this is the practice assessment. So those that meet the standards move on to self-directed learning. Those that do not meet the standards, these people are of higher risk and they receive additional attention. First, coaching by a peer and then a reassessment. If the remediation worked, they are now meeting standards and they move on to self-directed learning. If the pharmacist is still not meeting standards, they receive further attention from the college in the form of a QA assessment and then evaluation and prescribed remediation by the QA committee. So the key messages for a QA program is, first of all, to use a multimodal approach. Second of all, to focus on right touch, focus on the activities that will make a difference in patient care. And third of all, focus on a risk-based approach. So focus more regulatory attention on those that are of higher risk. Thank you very much. I appreciate the opportunity to be part of this panel.
Thank you very much, Sandra, for this interesting presentation. Coming from academia, I feel that it's interesting to learn about what is happening in the practice. So thank you very much. Our next speaker is Marwan Al-Aqil. Marwan I introduced him briefly in the beginning of the session and he presented a few slides. He is the projects manager for workforce in FIP. He is a clinical associate professor in Lebanese International University in Lebanon, and he is a visiting scientist in the University College London, UK. He has a PhD in public health from the University Paul Sabatier Toulouse, and he is the journal editor of Pharmacy Education journal that we all know. Thank you, Marwan, for being with us today, and the floor is yours.
Thank you, Banan, for the session. Thank you, everyone, for the wonderful presentation. It was really diverse, and we'll get back to the panel discussion. What is really different about this session is that we're having like answers directly to the questions from different speakers. So I will be very brief in order to keep room and time for some questions at the end, because we are sure that we'll be having more and more webinars on publications and the quality of research. So I will be very brief talking about the quality of scientific paper. And we cannot talk about quality assurance without making sure that we talk about quality assurance in the publications. So some tips in order to have a quality paper or a quality document out. First of all, for the researchers, we need to have a relevant literature survey, innovative research idea, clear objective or objectives, authentic data, reproducible results, critical analysis of our results, suitable interpretation, accurate statistics, a coherent document, because it's very important the way we present our findings, we narrate what we have, and we compare what we are having to other data in adequate length, because we have also to make sure that the message is out there without being very lengthy in writing, and a smooth flow of the report. We do know that if we can stay a little bit, Banan, in the previous slide, we do know that we have like a huge number of manuscripts that are being submitted to different journals, all the journals. And the research is really very dynamic everywhere in the world. But we need to make sure that what we are publishing is of quality. And this starts from the beginning until the end, from the idea until the paper is out. And it is the responsibility of everyone. So we need to talk about rigor. We need to be rigorous in our way of searching, of presenting, and of publishing our data. If we can go to the next slide. So the responsible parties, we're all a team, I think. There is no that the author at one side and we have the reviewers and the editor at the second side. We're all here to serve research, to serve science, and to provide data to science and to the readers. Of course, the journal is the way how, or the tool that we publish in, but we should never forget this cycle. Author, then the journal, then the reviewers, and then the editors. We're all responsible to have like good data out and trusted data to be out for publication. Talking about that, I would like to invite all of you to submit your manuscripts for the Pharmacy Education Journal. Workforce and education manuscripts are accepted, and we'll be aiming soon in order to include other research practice areas like practice and science in our journal. Thank you all. I will go back to Banan for the panel discussion, and please feel free to send us your questions on the chat box or on the Q&A box. Banan, the floor is yours.
Thank you very much, Marwan, for this quality assurance presentation about publication. And we all hope to have more and more publications that are of quality in the coming near future. The floor now is open for the panel discussion. If there are questions in the Q&A chat box, maybe Marwan can present these questions.
Yeah,
if not,
sure.
I have also a few questions for the panelists.
Yeah, we do have a question. We do have some questions that were answered live by Abir, and then I answered some questions on the Q&A box. But we have a question for Sandra that is coming from Pascal. And Sandra, the question is the quality assurance in Toronto used to regularly assess practice, and is it linked to license renewal? And maybe we can like ask this same question to Bronwyn to ask about what's happening in Australia. Sandra, we start with you.
So yes, the quality assurance program is used to regularly assess practice. We are trying to engage each practitioner once every 5 years with each of the activities. So they might have a practice assessment this year, maybe they would have a knowledge assessment 2 years from now, and then at some point they would also be engaging in the self-assessment. It is a requirement of being licensed to engage in the quality assurance program when required to do so, but it's not something where every year when they relicense that they have to declare or say that they've done a certain number of CEs or anything like that. We basically require them to engage in the QA program when we ask them to. So, and if they don't, the QA committee has a number of powers. We can move somebody to the inactive register. We can refer them to conduct. So there are a number of things if they do not engage in the quality assurance program when asked to.
Thank you. Thank you for that. Bronwyn, your side, this question, how does it apply to Australia? Is like quality assurance directly related to renewal of practice, or if we're talking about training, and of course, how does this link from education and training to real practice?
Thanks, Marwan. I will talk about it from a training perspective, and that's really around the ensuring that the education providers who are providing pharmacy education in Australia are accredited against the standards that we set. And we have a 6-year accreditation cycle. So every university program that's providing a degree in Australia will undergo a full reaccreditation every 6 years. And if they don't meet accreditation, then their graduates are not eligible to be registered or licensed in Australia. So the process is an ongoing process with monitoring for education providers on an annual basis and on an as-needed basis, depending on conditions and other monitoring. But every 6 years is a full reaccreditation of the program.
Thank you, Bronwyn. Thank you. Mike, if we want to talk about quality in education, and if we do have like faculty or school of pharmacies that are here and they want to start improving their quality, where should they start? What are the first steps in like improving or in trying to optimize the quality of what they are offering?
I would say the very first starting point, and would be a commitment to developing a culture of assessment and excellence at the program. And I think if they've already expressed an interest to do that, that's a good early sign that they're starting to think about these issues and pay more attention to them. I would certainly encourage them to look and use the tools that FIP have developed in this area. I think FIP has developed a nice range of tools which are intended to be very easy to use and very helpful. So this is, I think, an excellent start. But to start with those discussions internally within the faculty, within the college, I think is ideal. And we're seeing more and more schools now recognizing that they need to have a structure and a process in place. So we're seeing colleges of pharmacy establishing quality assurance units within the college, giving specific responsibilities to individuals to make sure that there is a strategic and conscious and systematic focus on quality and quality assurance. So these are all the early steps. But as I said, I would encourage them to reach out to FIP and take advantage of some of the tools and resources that are there. And then, of course, there are now a number of different bodies, accrediting and quality assurance bodies that are starting to be active internationally. and they're available certainly to help and guide people, whether it's going formally all the way to an international accreditation, or even just to help and guide. So ACPE, for example, tries to collaborate with FIP through a memorandum of understanding, so that we're working together to help and advise schools that want to move in this direction. So I think there's a number of different opportunities and ways for them to start doing that. But it obviously has to start with developing that culture and that commitment and the structure within the College of Pharmacy to give a greater focus to that area.
Thank you, Mark. Thank you. Banan, we go back to you for your questions to Abby or Abir. We still have around 4 minutes before handing over to Chris.
I have a question actually for Sandra, because for the presentation of Abby and Abir, since I was part of developing the QA tool, so it was quite clear for me, so I don't have a question about it. So my question to Sandra is about, I don't know if you have a percentage of pharmacists who usually don't pass the practice assessment. Is it a high standard of pharmacists? And if you have done any kind of analysis of reasons of why these pharmacists are not passing the practice quality assurance.
So yes, that's a good question. We do have probably about 10% of pharmacists that are not meeting the standards on that first assessment. But then once they go through the remediation and the reassessment, most of them are successful. So we only have about 2 or 3% that go on to the follow-up assessment and the QA committee. We also have, though, that of all of those people that are assessed, there's about 15% that are meeting all of the standards, all of the performance indicators. We have a good percentage of them where there's some feedback being given by our practice advisors to help them improve their practice. So they're passing and they're meeting the standards, but there's room for improvement. And the second part of your question was, are we seeing any information around what type of practitioners? So we've had a quality assurance program in place for a long time. This recent iteration is probably from about 2015. So just based on our previous program and this one, I mean, we do know that people that have been in practice for a longer time, that's usually one of the issues. The type of practice setting, we see that often hospital pharmacists do better than some of the people in community practice, but there's a very slight difference there. Where their initial training was also makes a difference. So those are some of the key factors.
Thank you, Sandra, and thank you, Banan.
Marwan, I just want to add, there is a question in the chat box in the QA.
We have 1 minute, Abir, please.
Yeah, about like in a given country, how many years it will take to reach a stage where quality assurance is mandated for practice. And hopefully that's our aim from the tool, like try to get more information about the education and the practice side. The more info we get, the more we can assess in each different country and the levels that we need to progress with. Thanks.
Thank you a lot,
Marwan, if I can chime in, I appreciate the panel, actually the comprehensive approach to quality assurance. I wanted to encourage everybody to use the tool that we have at FIP and please spread the words. A lot of time when I presented FIP, members were not aware of these resources. So we'd like you to be part of that, active part of the Q&A, but we also want you to spread the word on the framework that we have at FIP.
Thank you, Abby. Thank you. Thank you, everyone. Thank you, Aline. Just a question, Aline. Do you do trainings for new researchers that come to your lab for quality assurance? Yes or no? And how much does it take? Is it long?
It is not a comprehensive training. However, when we give them, because we usually give them training along with other courses for the master's students. So we highlight the importance of having a quality assurance and how to maintain everything related to different steps of quality assurance to be able to have reliable and accurate results.
Thank you a lot. Thank you.
So much.
Let's go to Chris John, FIP lead for data and intelligence for his monitoring and evaluating activity. Chris, the floor is yours.
Thank you, Marwan, and hello, everyone. I'm going to be very brief. Please do stay with us, because what we have for you is just a brief activity that will help us with monitoring and evaluating the Development Goal 3, Quality Assurance. This is going to happen via the FIP Global Pharmaceutical Observatory, whose mission centers around data, intelligence, advocacy, and reporting. And we know the importance of data, particularly from this pandemic, but data is vital for all the development goals, and data provides us with evidence, and evidence provides us with intelligence, and that equally applies to Development Goal 3, Quality Assurance. Next slide, please. Again, very briefly, the outputs and inferences of the Global Pharmaceutical Observatory, you'll see them on the screen there, but and the reason why we're here today is about the bottom bullet, which is health system strengthening by tracking progress against development goals. And Development Goal 3 applies obviously not just to health systems, but other systems as well, such as education and regulatory systems. Next slide, please. One of the key projects we're running is developing development goal indicators, so we can track progress and measure how we are going against the development goals. And this is where you all come in. Next slide, please. We need your help and expertise in engaging with a brief 5-minute activity to help us in developing indicators and metrics to measure and monitor progress with implementation of Development Goal 3. So you'll see on the screen now there is a QR code which you can scan and go to this brief activity, which we hope you enjoy. We'll be looking for your views on how we monitor and measure Development Goal 3. You can also click on the link on the slide, and I've also placed a link in the chat box, so you can click on that as well. We will be very grateful for your participation in this short activity, because your views will be very important and contribute to this big project we've got running on how we monitor and evaluate the development goals. So that's all I've got to say, because I know we're running out of time. You'll also get an email about this as well post-event. Thank you so much. Thanks, Marwan.
Thank you, Chris. Thank you, everyone, for clicking on the link and submitting your answers. We're numerous in this webinar, and we would love to have your input. So it would take a few minutes to submit it. Thank you for your attention. And next slide, please, Bana. So stay tuned to our upcoming webinar, which is about antimicrobial stewardship, which is episode 19, and the date is 24th of November. So stay tuned, and we'll see you in the upcoming webinars. Bana, the last word is for you.
Thank you very much, Marwan. Thank you, Abir, Abby, Mike, Eileen, and Sandra for your presentation, for your time. Thank you, FIP, for organizing these sessions that are really informative. And thank you mostly to our attendees of today's session. I wish you all a nice evening, nice afternoon, nice rest of the day, and good night if you are in the middle of your night. Thank you very much, and see you soon.
Thank you, everyone. See you. Bye-bye.
Thank you, everyone.